Hi, everyone. Thanks for the opportunity to talk to you today. My name is Bryan O'Malley. My name is Bryan O'Malley. I'm Executive Director of the Consumer Directed Personal Assistance Association of New York State. We're fighting for a stronger CDPAP for the consumers who rely on it and the agencies who administer it. You have my written remarks, many of which has already been covered in whole or in part by other witnesses today. Well, I'm happy to take questions on that. I want to use this opportunity to briefly talk about some of the competing levers pushing on our long-term care system and how the state has been addressing them. Namely, the laudable desire to increase eligibility through programs such as the Medicaid buy-in expansion and last year's Essential Plan expansion to cover long-term care, which are all too often running into a competing desire to minimize costs within the programs themselves. When you don't provide the benefits in healthcare, coverage itself is meaningless. The enrollment for both Medicaid and CDPA is clearly laid out in law and regulation. The state determines Medicaid eligibility, Maximus determines eligibility for CDPA or personal care, the plan or county determines the number of hours a person receives. Fiscal intermediaries, or FIs, administer services. However, for years now, despite not having a role in enrollment or eligibility, the FI is continually blamed for the increasing levels of service. The fact is, the state's aging rapidly, and many who are aging are poor. Research indicates the poor will have a much greater need for long-term supports and services, in large part due to the physical impact of poverty. Families are doing what they can to keep loved ones at home, something the governor and DOH do clearly like. They included LTSS in the Essential Plan, as I said, and they're proposing to expand the buy-in, Medicaid buy-in for working people with disabilities. We agree the expanded eligibility is a good idea, but can't help but notice the mixed messaging implicit in expanding coverage combined with cuts. If the governor wants to lower enrollment, she should engage in that discussion with y'all. We can then discuss the merits of providing these services. But instead, the budget cuts providers and worse, the wages of workers, all of whom are merely trying to ensure people have access to the services the government has said it wants them to have. Returning home care to minimum wage just throws gasoline on a workforce crisis that's already out of control. Making workers in CDPA second-class home care workers by removing them from wage parity would devastate the only program holding the long-term care system together. And the failure to require accountability to manage care plans to adequately pay for the services they're supposed to provide to their members instead of stealing funds meant for agencies to pay workers and further empowering them to make deeper cuts is just the definition of irresponsible. Thank you, and I'm happy to take questions.